Hello everyone, I am Ritu Sahani, a member of AOMPT. Today we are back with the new feedback of our latest course which we have finished just 2 days back. That was the cranial osteomanual therapy. This course was really a excellent course from AOMPT in the guidance of Dr. Senthil P. Kumar sir. I will say this is the very unique and the best course of 2021 from the AOMPT. In this course, we have started our all the session with the uh, skull journey. I will say that journey of the skull. How sir has started with the surface anatomy of skull. How we can understand the landmarks on the skull. Like we can say there is a bragma, vertex, lambda, astrion, patrus. So everything that surface landmarks is very important to learn. The vault hold, how we can hold the vault, that is very important here. Then we move towards the osteology of skull, where sir has given a complete view of all the paired and unpaired bones and the facial bones, the temporal, parietal, occiput, sphenoid, ethmoid, vomer, maxilla, zygomatic, all the facial bones, how they influenced each other with their functioning. Then we move towards the sutures, all the suture, how they divide all the bones. There are multiple sutures for the which separate the all the bones. The main is the coronal suture, sagittal suture, lambdoidal suture, temporomastoid suture, occipitomastoid suture. These all are very important to learn, because when there is a dysfunction related to the kinetic or kinematic, we have to release these sutures. That is very important, because in all the technique part we have to release all the suture after palpating and feeling the craniosacral rhythm. That is also very important part in this course. And the PRM, the primary respiratory mechanism, because I will say that cranium dysfunction related to breathing, inhalation, and exhalation is a very important part to learn here. And as well as I will say for the dysfunction which are related to midline bones and the lateral bones, that is also very important. Sir has explained all the very clearly how the frontal and sphenoid and the occiput in the midline, they influenced each other. Ethmoid and vomer all are in the midline. So how they influenced each other with the flexion and extension movement. So we have to check all the sphinobacillar junction, flexion, occiput, how the flexion influence the ethmoid and frontal bone, how the occiput pressurize the parietal bone. So everything is a completely we have to I think it's very important to learn. And how the lateral flexion of sphinobacillar junction influence the temporal bones. One side temporal bone compressed, so it for releasing this that temporal bone adopt the external rotation. So there are biomechanics of all the sutures and joints. We can palpate it, we can feel the craniosacral fluid rhythm with the auscultation, with the tunic fork and with the hammer. We can check it, one bone effect on another bone, by keeping the tunic fork and listen the auscultation of another bone. That is also a very important part which sir has explained in a very clear way, how each bone and the suture we can check with their kinetic and kinematic influence to each other. And after that we move towards the dysfunction of particular each and bone dysfunction. We have started with occiput, how the occiput dysfunction influence the upper cervical region, how the sphenoid the dysfunction react on influenced on the frontal, ethmoid, vomer. These are the main which influence we can see with the treat that dysfunction, this type of by giving the release of the sutures. And so many techniques sir has shown us in a very clearly a practical, fully practical demonstration session. Each and every point sir has cleared with a clear view, so that we can understand the mechanism. Because I think I will say to treat the cranium is the finger movement and the hold movement is very important. How we hold the vault and how we feel the points, how we release, how we keep the our fingers on mastoid mandible, and how can we feel the zygomatic internal rotation, external rotation, by seeing the symmetry of face. How we can check the how the occiput the frontal bone the influence that eyes, the shape of eyes, how some people have a eyes are inward and some are outward. So how we can check it, the ear positioning, the temporal bone external rotation and the internal rotation, how the parietal bone movement like a wings, and the temporal internal and external rotation. So these are many things which we have learned from sir, because it was a very new topic for all of us, and really we have enjoyed this journey. Then temporal dysfunction, parietal dysfunction, maxillary dysfunction, each bone related dysfunction sir has explained with a fully practical demonstration, with all the techniques, with the breathing pattern. The PRM is the main base of this treatment. And as well as the one thing which I will say, that how that cranial primary is influenced the visceral, and how the cranial primary is influenced the somatic. That is also very important, which we have learned from sir, that how that cranium, the membranes shift midline or unilateral dysfunction creates the somatic, the muscles tightness. So we have to check with the full body assessment, with the internal rotation of upper limb and external rotation of lower limb with the somatic, and how the visceral, the midline organs of visceral like heart, lungs, how it affects the cranium dysfunction affect the visceral organs. That is also very important, which already sir has planned a visceral course in the next month, that is also coming. So we will learn it more about that visceral organ there. But I think it was a great journey of cranium. I will say that we have enjoyed this course very nicely by the sir guidance, how he has shown all the dysfunction with the treatment and technique, all the technique that is useful for the patient. We can and one thing that is, we have started with the cranium and with the sacrum. So it is very clear. So if I will talk about the somatic, the cranium primary, so I will say that like the lower limb dysfunction related to sacrum, so upper limb dysfunction related to cranium. So we have treated cranium and sacrum together to treat both the dysfunction, either cranium primary with somatic, cranium primary with visceral. So everything is correlated. So we will move towards the visceral now. So I think it's a wonderful journey of full cranium course with the all the dysfunction with their treatment plan and the techniques, the different techniques, how we hold our finger, the magical finger movement is played a very great role here, which we have to learn from sir. Thank you so much, Dr. Senthil sir, for showing us a great course which has given a new hope for the patient to treat the occipital dysfunction, sphinovascular dysfunction, temporal, and all these facial asymmetry we can treat by after this. And attached course, the cranial neuromanual therapy that we have learned previously from you. But after this, that is also very clear how the treatment of all the cranial nerves influence the working of the cranial neuromanual therapy. So it's all combined a great course, the cranial neuromanual therapy as well as the cranial osteomanual therapy. The both course are I will really appreciate your effort, that how easily you have explained all the thing. And I will suggest to all the physiotherapists, please go through this course. These courses are very different from other courses, and you can learn that cranial neuromanual therapy as well as the cranial osteomanual therapy. That is a very important course. And you can release the cranial nerves with the foramen magnum release and the many other these are the just, I'm just taking a headlight of this course. Otherwise it's a very deep course, I cannot explain all these things now. But if you will go through this course, you will really enjoy this journey. So thank you so much sir for giving us a wonderful course. Thank you.